Good afternoon, welcome, and thank you to Dr. Davidson for joining me today, and thank you to the whole team who's done so much work on this project. This is an important milestone. So thank you to the team at NSH and beyond. Today we're taking another step forward for healthcare in Nova Scotia. We've taken a number of steps along this journey. We've made some pretty significant investments that have, some of those investments have created more opportunities for Nova Scotians to access care in their communities. We've actually created over 80,000 additional appointment opportunities every single month for Nova Scotians. It's pretty remarkable what the team has accomplished there. We've introduced technology that has put healthcare in the hands of Nova Scotians through the app. This is I talk to Nova Scotians every day about how they utilize that app and how it benefits them and gives them peace of mind in lots of cases, test results and appointments and all kinds of things. It's been an incredible step forward for healthcare. We've provided healthcare providers with significant additional tools to support safer and better coordinated care for their patients. Excuse me. We have a record number of Nova Scotians attached to a doctor or primary care provider. We've made incredible progress there, and across the country they're looking at Nova Scotia to see how we've done this and what we've done. But along the way, we've always focused on more access to care, more tools for Nova Scotians, more tools for healthcare providers, more technology introduced into the system. And they're paying off for Nova Scotians. And speaking of more technology, it was kind of crazy to me that to renew your health card, you had to either email or fax your application somewhere. That just seems so ridiculous in today's day and age. So that changes today with the launch of the MSI online portal. This is a web-based portal where Nova Scotians can update their MSI information, renew their health card, update their organ and tissue donation status, register or renew for pharmacare programs. They can do all this online, and that's the way it should have been. And effective today, that is the way it is, and that's a good step forward. But we're also announcing today that Nova Scotians can now opt in to participate in medical research opportunities. And this is something that I am most excited about and happy to be able to share with you today and talk to you today about. This is a discussion that at its core is about advancing medical research. It is about helping to find new treatments and also improving existing ones. It's about being part of a process and allowing Nova Scotians the opportunity to be part of a process that will most certainly help discover some new cures and save lives. And that's a really important thing. This is a discussion about giving Nova Scotians the opportunity and choice to participate in research and support people who are searching for new treatments and new cures. Nova Scotians have the opportunity now to be part of groundbreaking discoveries in cancer care, women's health, chronic disease management, and just general healthcare research. And any type of opportunity you can think about in healthcare, Nova Scotians will now have an opportunity to be directly participating in that. We're not aware of any other jurisdiction in the world that is giving its residents the opportunity to say yes to participate in medical research. As far as we can tell, we're the first jurisdiction to do this. And we're doing this by launching a centralized voluntary approach to identify Nova Scotians who are interested in participating in medical research. It means researchers can more quickly and consistently find, ultimately contact, and match people to relevant trials or studies that they are involved in. And the alternative is often that people search out those trials themselves. They get a diagnosis or something and they frantically Google and try to find what options might be available to them. This will turn that around and allow that connection to happen more seamlessly, and it will improve outcomes. I'm certain of that. It will also make Nova Scotia an attractive destination for trials. It will put us at the forefront of healthcare and medical research. That's the opportunity that's before us today. It will improve access to opportunities for people, and in some cases, It will certainly speed up access to medicines and treatments that might not otherwise be available to them, just might not have known about it or matched to it. So all of this means hope. It offers hope to people. We all know someone who's been given the worst possible news, a diagnosis that's terrible and frightening, and sometimes a diagnosis where they say there's just no cure, there's nothing we can do. And maybe that's true, maybe there isn't. But sometimes there is some cutting edge research and trials that are out there and that may work. So offering Nova Scotians the hope that they can be connected to that is, I think, something that's really important, and I'm proud that we're able to offer that today as the first step on that journey. It will provide hope where there was none before in many cases. You will hear, or you have heard, about our friend Brian Taylor and his experience, and he's willing to talk to you about that and hear just what a clinical trial meant for him, and how it may well be the reason that he's here today. And many of us will know, have our own examples in our own life of somebody who got involved in a trial and the impact it had on them. It's very powerful. So today we're talking about a voluntary process to opt in. It is opt-in. It's available to everyone. We understand it might not be everyone's choice, but the choice is there for them. So if you're 19 or older, you can register your consent to participate in medical research as easy as logging into the MSI online portal or by phoning. We've already created ways for Nova Scotians to have greater access and a greater say over the care that they receive. We've been very focused on that through our government. This is one more step along that journey. It's another step in enabling people to become more directly involved in their own care, but also in finding new treatments and improved care for themselves or for a loved one or for others that they may be supporting. Medical research is how we advance and improve the care that patients receive, both here at home but around the world. So this is an important day for Nova Scotia, and I'm proud we're able to deliver it. Thank you.
Thanks very much, Premier. We will take questions.
Premier, I think you have kind of touched on this, but I just wanted to kind of bring it to a point here. But for somebody who might hear about this story today who's like, I just wanted them to fix healthcare, how does this do that? Can you draw that line?
Well, first off, I think the progress that's been made in healthcare is pretty remarkable. So I don't accept those that say, well, nothing's better or nothing. Like, it's the work that's being done by healthcare practitioners, by people working in healthcare across this province. The results are remarkable. I understand that there are still maybe roughly 6% of the populations, and that is not attached to primary care. 6% is a remarkable number. I think the national average is more like 20. I think in next door in New Brunswick, they just announced their number and it was north of 20. So that's just one metric. It's certainly a metric that if it went the other way, I'd be getting beat over the head with it pretty remarkably hard. But I think we should acknowledge that there's been progress there. There's been progress on wait lists. There's been progress in people having access and control over their own healthcare journey. I think those are important things to acknowledge. That's the first thing I'd say to them. The second thing I would say to them is this is kind of one more step to kind of supersize that, to open up doors for them and connect them to people who are doing research or trials that aren't otherwise open anywhere else in the world, not as easily and not as seamlessly. So for those that opt in, their data can help them be attached to a clinical trial, and those will be situations that are where there might not have been hope for treatment or a cure. But so we'll do everything we can as a province to make sure you get into the system and that you get incredible care. I hear that day in and day out from people. When you get into the healthcare system in Nova Scotia, you get incredible care from people who are professional and who care deeply about your health outcomes. This is one more tool for those people to deliver care, but it's also one way that Nova Scotians can help themselves access care.
And you talked about making this an attractive destination for trials. And it seems to me that was something you talked a little about when you were down in the U.S. meeting some of the health tech companies. So could you just elaborate on that a little bit?
Yeah, I think it's the more activity around research that we can have here in the province, the better. And we have great researchers here already. We have all kinds of trials that are happening here. I think there's potential to have more, to cover more, more diagnosis and more situations. So, but I think the message that would be sent to those who are doing research is that this is a jurisdiction where they're trying to help themselves, and we can help them in their research. I think it's a good thing.
Dr. Davidson, maybe that same question. How do you think this will be viewed by medical researchers elsewhere?
Yeah, I think it's an excellent question, and one that we think about a lot as physicians and researchers. Increasingly, just like so many other industries, medical research is global. And we are involved in collaborative studies, not just nationally, but also around the world. And the pace of research is fast. And people who are launching clinical trials, entities who are pursuing this research, want to know if they have a promising medication, a promising innovation, where can I do this trial effectively and with considerable benefit. And I think what this kind of initiative has the potential to show those entities is that we will be able to rapidly demonstrate, number one, that we have a population of individuals, of patients who are interested and truly committed to research. If we do see significant uptake on this initiative, and I believe that we will have data that we can show to entities saying, in Nova Scotia, people want to participate. If you bring your trial here, if you collaborate with our scientists, people want to do this. And I guess the second part of that is that we will have information on what particular trials are most applicable to people in Nova Scotia. Right? We will know from this that the people who respond are people who have diagnosis X or potentially diagnosis Y, and as a result, those are the trials that we as researchers should go after for the impact that we want to have here in Nova Scotia. So not just the fact that we hope that entities will want to collaborate with us increasingly, but also they'll want to collaborate with us for the trials that are most of benefit to Nova Scotians.
Sorry, you mentioned
That's pretty great. You'll take all of us.
You mentioned uptake. Do you guys have any goals or any targets in mind in terms of how many people you hope to participate in this?
So we were just talking about this actually just earlier before we came on, and I didn't have a number other than that. Obviously, the more the better. And I will say from my experience in clinical practice, even though research can be a daunting word, when people don't exactly understand the work that we do, I am always touched in the clinic by how eager patients are to participate. So I'm optimistic that we will have a good uptake in terms of what we're targeting. I don't know, Mr. Premier, if you're able to speak to that.
I would never give a number that I can be, because, but certainly over time the number will be higher as more people learn about it, as more people have confidence. So, we'll be working with people in the system, family doctors or otherwise, to make sure they're educated. They can share information with their patients across the system. So, I think it's probably incumbent on all of us to share what's possible here and how they can benefit them. But I think I think the app would probably a good indicator. I don't have the stats on the app, but I know the experience of the trajectory. Initially it was kind of quick, and then it leveled off. And I think the number of downloads of the app now, as more people know about it and are more comfortable with it, is pretty significant. But this is an opportunity for people to not only participate in the greater good research, but also it's an opportunity to help themselves. So in a very self-serving way, people should be interested in opting into this.
Just before you wrap up here, we have just want to check in on Zoom one more time. Michael McDonald, I know you expressed some interest in asking questions. So did you have a question for either the Premier or Dr. Davidson?
Yes, I have a question for the Premier.
Sure, go ahead.
Premier, are you not concerned that Nova Scotians will say no to sharing important, intensely private medical information because it might be shared with the wrong people? All we have to do is look at Nova Scotia Power and see that many Nova Scotians have their financial information shared on the dark web. Maybe there'll be reluctance there that you'll have to overcome.
There's certainly going to be people who are nervous about this. There'll probably be a bit of off the wall theory, shall we say, about what's driving this. But what is really driving this is saving lives, and this is an initiative today that, if we save one life through this process, it'll be a success. But I think, and Dr. Ashley spoke about some of the. I think maybe spoke about some of the criteria. These are accredited researchers and accredited trials, and there's all of the personal information protections that could possibly be in place will be in place with this. It is health data. It's extremely sensitive to us as a government and certainly to the patient. So we'll take every precaution, but this is it's a step forward. It's progress, and we'll take it as cautiously and safely as we can. But it's a step that's necessary.
Okay. Is there a follow-up question, Michael?
No, thanks.
Okay.
Sorry.
Yes, please. Yeah.
Dr. Davidson, I think this might be something more for you, but can you talk about who would actually be doing this research at this stage? Is it mostly Nova Scotian scientists and researchers doing it, or would it be other folks in Canada or broader than that?
So that's a question, I guess, about the nature of the announcement and the way that there are 4 ways that people can actually provide consent. And I think I want to emphasize also that they're providing consent essentially to be contacted for research. They're not providing directly with this initiative a consent to participate in a particular study. So the way I think about this is that this is information that will be used by Nova Scotian researchers. And that's Nova Scotian clinical researchers, that could be Nova Scotian basic science researchers. There's a remarkable number of good scientists and good physicians who are doing this research here. I believe that there is one of the tenets within the ways that we can share information that involves collaboration with outside entities. So the way that I think of this, though, as a researcher in Nova Scotia, is that this will be used by our community, and I can't speak as much to what will happen with other organizations.
I just have 2 questions for the Premier. They're both for colleagues, so a little off topic. But on the topic of healthcare, the Fraser Institute says Nova Scotia should let the market determine how many students should be able to train to become doctors, as seen in other countries, rather than have a set amount of seats allocated. I guess, what are your thoughts on this?
Sorry, I didn't see that study. I don't quite get is the question speaking to too many seats at medical schools?
I think the question is sort of from my understanding from my colleague, it seems to be, why do we sort of have a limit on how many students can become doctors within the province as compared to other countries who might not have limits on seats for doctors?
Oh, I don't think we're not imposing some limit or cap. Certainly we're going the other way, actually, when you think about the PACE clinic, which is the path to credential like foreign trained doctors and foreign doctors, to credential them into Nova Scotia. That's kind of a new addition to the system over the last year with the goal of more doctors. So there's we're not imposing any type of cap.
And I have just one other question. So I know last week Prime Minister Mark Carney floated the idea of lifting provincial bans on U.S. liquor if the states make progress in other trade areas. I guess, what are your thoughts on that? And if the Prime Minister directed you, what are your thoughts of that? And if the Prime Minister directed you to lift the ban on U.S. alcohol, I guess, would you at this point?
Yeah, I've offered to do that too. What my position is, I'm not at the negotiations tables. So I don't know firsthand what's happening there. We had a reaction to the actions from the U.S. and one of them was the kind of removing the U.S. alcohol. But if certainly if the people at the negotiating table said that that's an irritant, it's a problem, we'll be guided by the people at that table. We're more than happy to work closely with them on that. I've made that offer to the Prime Minister probably a year ago or something as well. Okay.
Can I just quickly ask you a question about the Hutchinson's maple syrup farm? They were just told that they lost their lease. So my colleague's just wondering, what does the province intend to do with that land? that's being leased to Hutchinson Acres, and is it forestry or is it mining or?
Yeah, so I don't have a full workup on that, but my general understanding is that they had been leasing the land. There was some conditions to the lease, and maybe that weren't met by the proponent. So there was some action being taken by the province. But certainly, my wish would be that it stay in production of some sort. So whether the next step is to put it out for tender or something, I just don't know for certain. But my wish would be that stay producing economic value for the province. Okay.
Any other questions related to today's announcement, just before we wrap? Okay. Thank you so much,
Thanks, everyone.
Premier.
Appreciate
Thank
it.
you, Dr.
Yeah, thank you.
Davidson. Thanks.